Hello friends, I am Dr. Prashant Sharma and you are watching MEDICO'S Hub. This is my second lecture on glycosides, and in this lecture I am going to discuss some physiologically important glycosides or therapeutically important glycosides. We can remember the common examples of such glycosides by this sentence. Glycosides do have vast effects. This is Digitoxin and Digitoxin. This is Oaben. This is vanilla. This one is anthracyclines. These are also known as anthracycline glycosides. Anthracycline glycosides include daunorubicin and doxorubicin. And the last one is streptomycin. Now, first we'll discuss the Digitoxin, Digoxin and Oaben. First one is Digitoxin and Digoxin. These are obtained from Digitalis purpurea and Digitalis lanata. The members of genus Digitalis are commonly termed as foxgloves, while the Oaben is obtained from Strophanthus combe. That's why it is also known as G. Strophanthine. These three drugs, that is Digoxin, Digitoxin and Oaben, are of a category cardiac glycosides. Now, what are cardiac glycosides? These are organic compounds that decreases the cardiac output, increases the cardiac output and decreases the heart rate without significant change in blood pressure. Commercially, these are obtained from foxgloves. We know that the members of genus Digitalis are known as foxgloves, mostly. While some of the cardiac glycosides are also obtained from cane toads. These are Bufo marinus. Now, what is the utility? These are used in treatment of congestive cardiac failure and in patients of arrhythmia. Now, what is the mechanism of action? For this, let us assume this is a cell, cardiac cell. Cardiac cells are having two types of transporters. This is sodium potassium pump, that is sodium potassium ATPase, and this one is NCX, that is sodium calcium exchanger. Both are located in the plasma membrane of cardiac cell. Now this is sarcoplasmic reticulum of cardiac cell. It is having SERCA2. What is that? Sarcoendoplasmic reticulum calcium ATPase 2, SERCA2, and its main function is to absorb calcium from the sarcoplasm into the sarcoplasmic reticulum. Now, what is the mechanism of action of cardiac glycosides? These cardiac glycosides inhibit the sodium potassium pump. Now, this will result in increased concentration of sodium, that is in intracellular fluid. So intracellular sodium increases because this pump is blocked and it is unable to pump the sodium out of the cell into the extracellular fluid. So level of sodium or concentration of sodium increases in the cell, and because of this pump is also affected, and this is unable to work, because of which more calcium is retained in the cell because it is unable to pump the calcium out of the cell into the extracellular fluid, and because of this intracellular calcium increases. Now SERCA2 has to pump more calcium in the sarcoplasmic reticulum, and on next stimuli it will release higher amount of calcium into the sarcoplasm, leading to stronger contraction and increased cardiac output. So this is the mechanism how the cardiac output is increased. Now what about the heart rate? So for that, refractory period in AV node is increased, because of which heart rate is decreased. So this is the mechanism of action of cardiac glycosides. In the next lecture, we'll discuss the biological importance or role of vanilla, anthracycline glycosides and the streptomycin. Hit the like button, share and subscribe our channel to get the latest updates and notifications.